Ashley from Demystifying Your Health. I am so glad that you're here today because we're going to be talking about a really important topic. Heart attacks. Obviously, this is a very concerning thing for most people. And it can be incredibly scary if you're having one. So we're going to be taking a look at what symptoms you should be looking for, how are they diagnosed, how is it treated, and what you can do to prevent one. So without further ado, let's get started. So heart attacks are also called MIs, which is short for myocardial infarction, or AMIs, which is short for acute myocardial infarctions. And myocardial refers to heart muscle. Infarction means that there's a blockage. So this results from your heart muscle not getting enough oxygen from blood flow being reduced to the blockage. And when your heart's not getting enough oxygen, this is referred to as ischemia. And the blockage occurs because of the narrowing of the arteries from buildup of fat, cholesterol, and other substances. Collectively, this is usually referred to as plaque. And this process takes years and is known as atherosclerosis. So it's not something that's just going to happen overnight. And typically, a piece of the plaque breaks off and gets stuck somewhere in the arteries that surround your heart. And as your blood starts to sit behind it and pool, it starts to clot. And the blockage can be complete or partial. Obviously, in either case, it's not good for your heart muscle. When it comes to heart attack symptoms, we've all seen TV. There's a person, usually a man, who clutches his chest suddenly, falls out of the chair, and ends up on the floor. And while this is very dramatic, it's not necessarily how heart attacks actually present in real life. Yes, chest pain or discomfort that's either mild or severe is the number one symptom. However, some other symptoms can include shortness of breath, feeling like your heart is beating too fast or skipping beats, which is called palpitations. The pain goes from your chest to your shoulder, your back, or your arm. You have nausea or vomiting. You have heartburn, stomach pain, sweating, lightheadedness, sudden dizziness, and fatigue. And it's important to note that you can have all of these symptoms. You could have just a few of these symptoms. Each person's different in how they present when they're having a heart attack. I've seen people having a heart attack who've had just heartburn and nausea and vomiting. And they come in for that, and we happen to do an electrocardiogram, an EKG, and lo and behold, yes, they're having a heart attack. And it's also important to note that women, while they can present this way, they typically have their own unique set of symptoms. This is more of how a man might present with a heart attack. For women, they might have an uncomfortable sensation in their chest, such as squeezing, fullness, pressure, or pain. They might also have pain in their jaw or back with no chest pain. They could have shortness of breath with or without any chest discomfort, nausea, cold sweats, or lightheadedness. And it's also important to note women are more likely to have a heart attack without any symptoms than men. Oftentimes, because your heart retains this damage, that if on a future EKG it shows up that you've had a previous heart attack, but I've never had one. Well, you did at some point, you just didn't realize it. And it's important to note that most heart attacks, while they do come on suddenly, there's usually some warning signs. They just don't come out of the blue. And typically this is something called angina, where you have recurrent chest pain or pressure that's triggered by activity and then relieved by rest. Usually this starts appearing at least a few weeks in advance of you having an actual heart attack. This is why it's important if you experience this stuff, make sure you go to your doctor and get checked out so that way hopefully they'll be able to prevent you from having a heart attack. And obviously if you have any of these symptoms of any kind that you're concerned about, call 911 immediately so you can get to the nearest hospital. If they're not available or if it's easier for someone to drive you to the hospital, have them take you there as well. Time is of the essence because obviously you want to restore blood flow back to your heart. Otherwise, you could end up going into cardiac arrest. You don't drive yourself to the hospital unless this is no other option for you, because otherwise your chances of getting into a car accident where you get hurt or killed or you hurt someone else and kill them is significantly higher if you're in the middle of having a heart attack. When it comes to the factors that can increase your chances of having a heart attack, these are numerous. One of them is age. For men who are 45 or older, or women who are 55 and older, are at greater risk of having a heart attack. Obviously, if you smoke or you have long-term secondhand smoke exposure, your risk is higher. If you have high blood pressure, high LDL cholesterol, which is low density lipoprotein or the bad cholesterol, and having high triglycerides. If you're obese, have diabetes, have metabolic syndrome, which is when you're obese, have high blood pressure and high blood sugar. If you have a family history of heart attacks, you don't get enough physical activity, you have high amounts of stress, you use illicit drugs, you have a history of preeclampsia, which is when you have high blood pressure during pregnancy, or you have an autoimmune condition, such as rheumatoid arthritis or lupus. All of these things increase your chances of having a heart attack. And it's important to note that obviously heart attacks can cause serious complications in your body that are long-term. The most obvious is that you have sudden cardiac death, which means that your heart stops beating and won't restart. Other potential issues could be arrhythmias, which is an abnormal heart rhythm, or your heart can go into heart failure and then never be able to come back out of it. While you might still be able to survive, your quality of life and day-to-day impact with heart failure is significant. To diagnose a heart attack, the most common thing that is used is an electrocardiogram, or ECG. And this is where you're going to have a bunch of stickers placed all over your chest, arms, and legs, and then you're hooked up to the cardiac monitor. Usually there's changes on this that indicate that you're currently having a heart attack, and in some cases they can see that you've had one in the past. The next big thing they're going to look at are blood tests. There are certain markers that become elevated when you're having a heart attack. And if you are having a heart attack, your doctor's most likely going to order a chest x-ray, an echocardiogram, which is an ultrasound of your heart, a cardiac CAT scan or CT or MRI, and possibly a coronary angiogram, which is basically a cardiac catheterization. And they're trying to see where is the blockage, what else is going on, and make a determination so that way they know how to treat what is happening to you. When it comes to treating a heart attack, the number one goal is to restore blood flow to the area that's not receiving it. And this can be done through two major methods, medication or surgery. Usually, if you're in an ambulance, they're going to start doing the medication part of it in there, and then it's going to continue when you get to the hospital. The surgery parts obviously have to be done at the hospital. So when it comes to medicine, you have aspirin, which helps reduce the blood's ability to clot. Next is morphine, which is obviously to help with pain. Nitroglycerin is a type of medicine that is usually placed under the tongue, and it's helped to dilate blood vessels, that way basically giving the blood more room to move. And it's also going to lower your blood pressure as a side effect. Beta blockers are also to help lower your blood pressure, which helps reduce the work your heart has to do, and it's going to slow your heart rate down. Thrombolytics are essentially clot-busting medicines. They go in there and they bust up the clots. Obviously for this, the major side effect of this is it can increase your chance of bleeding. Antiplatelet agents are to make it so that way your blood doesn't stick together as well. And there's other blood thinning agents that are similar to the antiplatelets, they just work a little bit differently in your body. ACE inhibitors are also to help control your blood pressure and help your heart muscle actually relax and not have to work as hard. And then statins are anti-cholesterol medicines. They're to help lower your cholesterol. Obviously, ACE inhibitors and statins usually are used more in a long-term treatment situation versus an emergent situation. When it comes to surgery, coronary angioplasty and stenting, which is also called PCI, which is short for percutaneous coronary intervention. And this is a very fancy name for what they're going to go do and go take a catheter and either find an artery in your groin or your wrist and then move the catheter up into your heart using x-ray imaging with IV dye. And what they're doing is they're looking for where the clot is. And then when they find the clot, they go in and with the balloon that's on the end of the catheter, expand that balloon enough that it busts up the clot, and then they slide a stent off the catheter into the artery, and that helps keep the artery open. The other big option for surgery is coronary bypass surgery, and this is open heart surgery. So what the surgeon's going to do is open up your chest and find the clotted off vessel, and then use a graft of a vein or another artery from somewhere else in your body that is not to a vital organ or anything like that, but superficial, and then put that on and attach it to your heart, and then redirect the blood flow around into the new graft that goes around where the blockage occurs. So as you can see, obviously there's plenty of different options, and initially you're going to start with medication, and then if needed, then you're going to move into the surgical procedures. And your doctor's going to be there with you every step of the way. It's going to help guide you as far as what you need to have done. After you have a heart attack, your doctor is going to want you to make some lifestyle changes for a couple of reasons. One, it's going to help you recover better, and two, it's going to prevent you from having another heart attack. The good news is these changes are the same as preventing a heart attack, so let's take a look at them now. First is avoid smoking or being around secondhand smoke. The next is obviously controlling your blood pressure and your cholesterol levels. You want to get regular medical checkups, and you want to maintain a healthy weight. You can do this by eating healthily, such as having lean proteins, fruits, veggies, and whole grains, while limiting fats, processed foods, salt, and excess sugar. You also want to exercise regularly. So the current recommendations are 150 minutes of moderate or 75 minutes of vigorous, or a combination of both of these type of activities every week. If you have diabetes, you need to manage that. And you want to find ways to reduce stress. This is especially important because obviously you don't want your heart to be stressed out. So you can try yoga, meditation, mindfulness, breathing techniques, whatever you find that works for you. And you want to either avoid or limit alcohol. So for women, this is no more than 1 standard drink per day, and for men, this is no more than 2 standard drinks per day. And a standard drink depends on what type of alcoholic beverage you're consuming. Heart attacks are a very serious medical condition that need prompt treatment, and in that case, they should get better. You can also prevent one by following the techniques we just talked about. Thank you for joining me today. If you have questions or comments, please put them below. I would love to hear from you. Please like, share, and subscribe. And until the next time, stay healthy.